8:10, it is back to school time, and lots of people are talking about whether or not students should wear masks at schools this fall. The American Academy of Pediatrics says yes. This week they made that recommendation. In their guidance, they said a significant portion of students are not yet eligible to get the vaccine, and universal masking will help reduce transmission of COVID. Our 9 News health expert, Dr. Payal Kohli, joins us this morning to talk more about that. Good to see you.
Good morning, Gary.
Good to see you in person.
Absolutely.
We've talked on Zoom like 1,000 times. All right, so the AAP is recommending in-person schools for this fall should continue with some virtual learning, I guess. What's your take on that?
So the American Academy of Pediatrics, Gary, looked at all the data from the last year and said, based on the low rate of transmission in the schools, they're strongly recommending all the kids go back to in-person learning this year, despite the fact that there are some kids under 12 that are not yet eligible for the vaccine.
Right. So they'll be back at school, but will they be wearing masks? I guess that's the question, right?
So the American Academy of Pediatrics says yes, and they say yes for a few reasons. Number one, like we just talked about, a lot of them are not yet eligible for the vaccine. Number two, we have this new, more contagious, more aggressive Delta variant in the community that can, of course, spread faster amongst kids and adolescents. And then number three, I think it's going to be really difficult if your kids over 12 who are vaccinated can take off the masks, the teachers can take off the masks, but the young kids can't. So they think logistically, in terms of enforcement, it would be easier if everybody wore masks.
It is interesting. I know that a lot of universities are requiring that people be vaccinated before they start the fall semester. Lower grades, not so much. Do you have an opinion on that?
You know, I am so pro-vaccine because I think it is our way to end this pandemic. So I think if it is safe for the person to get the vaccine, I 100% think that mandating the vaccine is going to get everything back to normal very safely.
And I imagine if students do wear masks to protect themselves from COVID, it'll protect them from everything else too, colds and flu and whatever.
Such a great point. So I mean, the burden of colds and flu, and we're seeing RSV cases uptick as well, all of that will go down, and missing school and parents having to take time off. So it's really a good idea, I think, to think about this recommendation. Now there is some concern that everybody shouldn't have to do it if the cases in the community are low, but then we get into this idea of everybody doing something different and marching to their own beat, and that can be confusing as well.
It is confusing, and it's happening all over the country, unfortunately. All right, so we talked earlier about a lot of kids just don't have the vaccine yet. They can't get it if they're under 12. Why is that taking so long, do you think?
So we have this vaccine, but we have to find the right dose, because kids are not just like little adults. They actually have different immune systems and different body sizes. So we have to find the right dose. The FDA also wants 6 months of follow-up data in kids, whereas they only requested 2 months in the adults. And that's, again, just to make sure that it's completely safe. So when all of that happens, we think the earliest data will come in this September, as President Biden said in the town hall the other night.
And do you anticipate that shortly after that, kids will be eligible?
I do. So I'm thinking, kind of early winter or midwinter, probably by December, we should be able to have our kids eligible.
That'd be great. Dr. Kohli, as always, it's nice to see you.
Nice to see you.
All right, thanks.